Hi, this is Dr. Brian Lee. Today I would like to go through a common symptoms that sometimes even the gut doctors find it challenging. And this challenging symptoms is the left upper quadrant pain. When it comes to this area, we should really think about what organs that is underneath the area that can cause the pain. If you look at this diagram here, I've actually made a simple version of it here just to outline all the organs that is involved in this area. So we obviously are interested in this area here. Let's focus on the organs here. So I've already labeled the organs that are involved in this quadrant. So we have your left lower lung, you have your heart, a stomach, spleen, colon, pancreas, a bit of small bowel, and also at the back a kidney as well. So start with the lung. I've seen patients who was complaining of abdominal pain and they actually were having pneumonia or a collapsed lung, and sometimes that can cause severe abdominal pain. Very rarely you can also get a clot in your lung. This usually causes severe pain when they take a deep breath in, and they are typically not related to food either. And the simple things that you can do to avoid these conditions are stop smoking and obviously avoid recreational drugs. Regular exercise is always good for your lungs, and doing diaphragmatic breathing. There is a muscle here and it's called diaphragm, and use the diaphragm to breathe rather than your chest muscle to breathe can get more oxygen into your body. The next organ is your heart. Heart attacks sometimes can come in with a bit of left upper abdominal pain. I've seen older patient or elderly lady who was having a heart attack in front of me but kept saying they have indigestion. So the best thing to avoid this is to change your lifestyle, including stop smoking, regular exercise, and healthy diets. If you're diabetic, please have a low sugar diet, and if you're overweight, please consider losing a bit of weight. And don't forget your cholesterol level. As you might know, high cholesterol level increase risk of heart attack and stroke. The next organ is your stomach. Stomach ulcer can cause pain in the left area. Inflammation in the stomach, such as gastritis, and that can be caused by lots of things, include cigarettes, NSAIDs, which is non-steroidal anti-inflammatory drugs, such as ibuprofen, Nurofen. Alcohol can also irritate the stomach lining, causing inflammation. To avoid sharing utensils, because there's a condition called H. pylori, which is an infection of your stomach, and that can cause stomach ulcers and inflammation. I would also avoid acidic food or drinks if you're getting lots of acid reflux. The next organ is your pancreas. Its function is mainly producing insulin and digestive enzymes for your body. Things like pancreatitis, which is inflammation of your pancreas, and the most common cause is gallstone. 50-60% of gallstone are cholesterol stone, and they are formed because of cholesterol and fat in your diet. Alcohol on its own is enough to cause pancreatitis. So the best way to avoid gallstone is to come back to basics, which is healthy diet. Also, too much calcium in the blood can cause pancreatitis, and there are lots of causes of hypercalcemia. There are certain drugs that can cause it as well, such as steroid, things like azathioprine, which is an immunosuppressant that we use a lot in gastro. The next organ is the spleen, and a big spleen can cause a lot of discomfort, and there's way too many causes for a big spleen. There are blood disorders, there are liver problems that can cause a big spleen. Alcohol is one of the biggest cause of liver cirrhosis. Particularly important to consider taking anti-malaria drugs, because malaria causes a big spleen. And make sure you keep all your vaccination up to date. If you develop a big spleen, you should really avoid contact sports, because it can rupture your spleen. Particularly important in traffic accident, make sure you wear a seatbelt, because the steering wheel will crash into your lower rib cage and potentially rupture your spleen as well. Now, let's move on to our next organ, the colon, which is my favorite organ. There are lots of causes of infection. or food poisoning. And the classic example is having vomiting and diarrhea after your dodgy Chinese takeaway. Second condition is inflammatory bowel disease, a condition where your body attacks your own body for no reason. That causes a lot of inflammation, and this condition really needs to be managed by us. Diverticulitis, so diverticular disease, is very common, particularly in slightly older population. It is basically wears and tears of your bowel, and what happens is you get these little pockets that form on your bowel wall over time, and these pockets, they don't really cause much problem, but the bacteria will colonize this area and also cause a lot of bleeding as well. When that happens, it is called diverticulitis. It is a condition that can be very serious when they become very infected. Some people will need surgery for that, and they can rupture as well, perforation, and leaks out all these feces into the abdomen, which is a nightmare when that happens. Irritable bowel syndrome, which is a topic on its own, is very common. That certainly can cause pain in the left side. And the simple lifestyle changes that I would advise is healthy diet, avoid Chinese takeaway or dodgy kebab, because sometimes you just don't know how hygienic these foods are, and ultimately you are risking multiple volcanic eruptions in the toilets, which in my opinion is not worth it. Secondly, control your stress. Your stress can speed up your bowel. If you haven't seen my video on gut-brain axis, please go and check it out, and hopefully you will understand how stress can actually cause all sort of pain and diarrhea. Avoid constipation, particularly important in diverticular disease. If you have lots of constipation, the more you strain it, the more pockets will form. So avoid constipation is absolutely key here. I will do a future video on irritable bowel syndrome, hopefully give you more information about it. If you worry about inflammatory bowel disease, you should really see a gastroenterologist or a gut doctor, because there are specialized tests that we have to do to confirm the diagnosis. Small bowel, similar to the large bowel, so you can get infection, you can get inflammatory bowel disease, you can get irritable bowel syndrome as well. NSAIDs such as ibuprofen and naproxen can cause inflammation in your small bowel, that can cause pain as well. So the key thing is to avoid NSAIDs if you can, control your stress, and healthy diets always. These are the fundamentals. So the next organ is kidneys, and the common causes of kidney pain are urinary tract infection, especially when the infection track all the way back up to the kidney, and that can be very painful and usually requires antibiotics as well. The second thing is kidney stones, and I've seen big chap really screaming in the emergency department with severe stone related pain, and he needed a large dose of morphine to settle him down because it's really painful. And the simple lifestyle changes would include make sure you stay hydrated, keep flushing your kidney, reduce the risk of stone forming in the duct. Cranberry juice, apparently there's some evidence that it can prevent or reduce the chance of getting waterwork infection. And for female, always wipe from front to back after you've been to the loo, because that reduces the risk of cross-contaminating from the back passage to the front passage. So these are all the organs that we've gone through today. You've probably got the message of these simple lifestyles. Honestly, these are the fundamentals. We always have to go back to these basics, okay? So stay hydrated and avoid smoking cigarettes or recreational drugs. Avoid alcohol, really. They are not really that good for your liver or for your pancreas, for your gut in general. Healthy diets including lots of greens, avoiding fatty food, and if you can avoid refined sugary stuff, then please do, because that certainly will help you achieve the weight that you want and avoid further symptoms as well. Number 5, control your stress. This is easy said than done, and it's about managing your focus, especially when you're really stressed. Find ways to calm yourself down or take care of these stress. And number 6, avoid non-steroidal anti-inflammatory drugs such as ibuprofen, Nurofen, naproxen, because they are really not very good for your gut or your heart, even your kidney. Number 7, regular exercise. I can't stress this enough. exercise is really, really important, and that doesn't only help your physical health, plays a big role in your mental health as well. How do I know which organ is causing the pain? I think the first thing you really need to do is to go and see your doctor. They should be able to do some basic tests to rule out a few causes, for example, kidney infection or kidney stones, or some stool tests or some blood tests as well to look for infection. If these things have been ruled out, you might need to see a gut specialist to rule out other causes as well. And I would really try to avoid self-diagnosing things, because this, even for us, sometimes we find it very challenging to figure out what's causing this pain. So yeah, please do go and consult your doctor. If in doubt, always get a list of questions ready for your doctors, because it's so much easier and so much more time effective and efficient that way. And what other tests that we normally do? We tend to do simple blood tests, possibly an X-ray of your chest to make sure there's no pneumonia. We can do heart tracing to look at your heart. As we usually start with some simple non-invasive scans, such as an ultrasound jelly scan, like the baby scan, and more invasive tests such as camera tests from the top end into the stomach to look for any stomach ulcers or inflammation, or a camera test up the bum to look at the colon, and CT scan or MRI scan to look at other organs in the abdomen as well. If you would like to know a bit more about gut health, please subscribe to my channel and leave a like down below as well. I hope you find this helpful.